I am 72 years old, and for the first 72 years of my life, I enjoyed tremendous health.
Glenn was doing his elliptigo and upper limb suspension training, and it was just a really nice, relaxed retirement lifestyle.
And then about mid-April, I was at my computer keyboard, and my left pinky finger and left ring finger began to not function. And then on May the 30th, I had a grand mal seizure. I was hospitalized. I was diagnosed with a glioblastoma, a tumor on the brain. When I got to my diagnosis, I initially thought, this is the end. And I thought in terms of weeks of survival, and at most. And it's a really damaging attitude.
So I think in Glenn's case, I think what was most challenging about his case is that everything kind of went to a head very, very rapidly. So he was essentially fine one day and essentially disabled the next. So I don't think he really had time to emotionally grasp the consequences.
The bad news is I had
resected, and so the tumor was removed and turned out to be a very high-grade glial neoplasm, which is a very common primary cancer of the brain. So even though it was removed in its entirety, the problem with brain cancers or glioblastomas is that they're very infiltrative, meaning there are cancer cells even within the normal brain that we really don't want to remove because brain function is important. The more we remove the brain, unlike other parts of the body that get cancer, you obviously have a lot of deficits. And so we try to preserve as much brain function as possible. And so in order to better take care of him, we had to use a combinational approach of both using radiation as well as chemotherapy.
One of the things that really shows the strength of our practice is that we're essentially credentialed in every single hospital in the East Bay. So we were able to see him in the hospital well before treatment, kind of go over his entire treatment plan, go over all the side effects and the kind of recovery that he could expect. And I think Glenn really appreciated that, because sometimes when you get swallowed up in the medical system, everyone kind of has their own niche and is not really certain what's going on in other aspects of it. So I think being in inpatient rehab for about 2 weeks before radiation started, having a conversation with myself and Dr. Kang, I think really improved his understanding and where he was headed.
The medical field is so specialized, and people say, oh, go online and go on the blogs, and you think, what do I know? And then you find a group of people who know, and they do. And that's what you look for.
With my first visit to Epic Care, I was interviewed by Dr. Prasad, and it was a interview that was as long as I wanted to make it.
The precision and care with which he was treated are amazing.
I think when you're diagnosed with cancer, there's a huge element of unknown, and am I going to live, and how am I going to do with treatment? Can I take it? How can I rearrange my life to get treatment? And I think one of the things that we're able to offer is that we're in a very strongly multidisciplinary way, that every patient kind of sees all of the specialists kind of at the same time. And I think that really helps them and kind of eases that feeling of uncertainty.
My reaction to the treatments and the side effects have been minimal for both radiation treatment and the chemo treatment. I've been feeling good. I did come through the surgery and the tumor experience with all of my cognitive abilities intact. My left side is quite weak. It's my understanding that the brain has quite an amazing capacity for developing new channels of communication, and with a little bit of luck and some therapy, I should regain strength and use of my left side. I think the thing to realize is that there have been many advances in the field of cancer research and cancer treatment. The side effects of treatment today are not what they were 2 years ago or 5 years ago. The most important thing is to maintain a positive attitude. This can be a phase that you can survive and be better for having survived it. I would say to the doctors and the nurses and the staff at Epic Care that I feel I have been really well treated. I feel that my disease is much more bearable because of the level of care that everyone has exhibited.
Thank you. In the middle of just chaos in your life, the real stability.